Psychosexual disorder is a term which refers to a sexual problem that is of psychological rather than physiological in origin. The problem may stem from obsession or preoccupations of the mind, thereby affecting behavior through displaying abnormal sexual acts. It's obvious that sexuality is a normal part of the human experience. However, the types of sexual behavior and attitudes about sexuality that are considered normal vary within and among different cultures. Problems of sexuality and gender may fall under the following three types. The first type is sexual dysfunction, in which there is impaired or dissatisfying sexual enjoyment or performance. These are the commonest. The second one is paraphilia, which is an abnormal way of satisfying oneself sexually. And the last one are disorders of gender identity. Here the patient feels as if they are of opposite sex or desire to change gender. So let's start with the first one, which is sexual dysfunction. The commonest problems presented for women under this category are low sexual desire. This may occur in both sexes but more common with women. In this case, sexual desire is low. This could be primary or secondary. In primary low sexual desire, here sexual desire has always been low. This could be fear of originating from childhood experiences, for example, sexual abuse, rape, or pain during sex. Secondary low sexual desire. In this case, sexual desire has been normal in the past but has become impaired. This could be caused by general problems in the affairs such as marital discord, depression, physical disorders such as endometriosis or an infection of the bladder or vagina. The second one is orgasmic dysfunction. This is characterized by inhibited orgasm during intercourse. The disorder may be lifelong or may occur in only certain situations. This may stem from tiredness, depressive disorders, and when the man is inexperienced in arousing his partner. The third one is vaginismus. This is characterized by pain during intercourse. There is usually painful spasms of the vagina muscles during intercourse in the patient. This could result from aversion to intercourse, painful scars, for example, after episiotomy. This worsened by an experienced or rough partner. The pain is severe during penetration of the penis. Dyspareunia. This is pain during intercourse which arises from partial penetration of the vagina. This may result from lack of lubrication with vaginal secretions. The commonest problems presented for men under the same category are premature ejaculation, which is ejaculation that occurs too early, usually before, upon, or shortly after penetration, so that the woman gains no pleasure. It may be as a result of prostate glands or a nervous system disorder. Apart from that, we also have retarded ejaculation, which is a condition where an erection is maintained but ejaculation is delayed for a prolonged period. Lastly, we have erectile dysfunction, which is inability to reach erection or sustain it long enough for satisfactory. We now move to paraphilia. Under paraphilia, we have fetishism, which is achieving sexual excitement by being in contact or touching an intimate object of a woman, for example, an underwear. This is very common in men and usually may steal or buy them. We also have fetish transvestism, which is experiencing orgasm by wearing underwear of a woman. We also have exhibitionism, which is experiencing orgasm by exposing genitalia to unsuspecting people. We also have pedophilia, which is experiencing orgasm by having sex with children. Other than that, we also have frotteurism, which is experiencing orgasm by touching his erect penis against the thighs or buttocks of a non-consenting female. This usually occurs in crowded situations. Moving to gender identity disorders, I came up with one disorder on this category, which is transsexualism, which can also be somebody whose sex is surgically changed, somebody who has undergone treatment or hormonal therapy to change his or her anatomical sex.